Smoking is injurious to eye health. WHO estimates that tobacco kills over 8 million people every year, including over 1.2 million from second-hand smoke exposure. The inhalation of tobacco smoke exposes the body to more than 4,000 chemicals. Ocular damage from these chemicals may even result in blindness. Numerous effects of tobacco smoke can be seen on ocular structures. There is an increased incidence of the following eye conditions associated with smoking. 1. Cataract. Worldwide, cataracts are the most common cause of blindness, where the normally clear lens becomes clouded. Smoking causes a high level of free radical activity leading to oxidative damage to the lens.
Furthermore, smoking depletes endogenous antioxidants such as vitamin C, E, and beta-carotene, which exacerbates oxidative stress.
Tobacco byproducts contain heavy metals, such as cadmium, lead, and copper, which accumulate in the lens and cause direct damage. High levels of cyanide and aldehyde in smokers' blood can modify lens protein and cause opacification. 2. Glaucoma. Glaucoma is a group of diseases causing progressive damage to the sight which finally leads to irreversible blindness. In glaucoma, the nerve in the eye called the optic nerve, which connects the back of the eye to the brain, is damaged, usually due to increased pressure in the eyes. Researchers found no significant association between smoking and intraocular pressure, but they did find evidence that smoking may decrease CCT, or central corneal thickness, which is an important factor to consider when measuring intraocular pressure. This suggests that CCT should be more closely monitored in smokers, to estimate a more accurate target intraocular pressure in the management of glaucoma. 3. Diabetic retinopathy. When diabetes affects the retina, the inner sensitive layer of the eye where light is perceived, it is known as diabetic retinopathy. This is a progressive condition and can lead to irreversible vision loss and even blindness. Smoking does not cause diabetic retinopathy directly, but it can impede healing and also create bleeding in the eyes for those who already have diabetic retinopathy. Patients with diabetes are advised to stop smoking in order to improve quality of life and delay the onset and progression of diabetes complications. 4. Age-related macular degeneration. Age-related macular degeneration or AMD is seen most commonly among people in the older age group, over 50 years, in which there is damage to the macula causing central vision loss. As nicotine has vasculogenic properties, cigarette smoke can stimulate the formation of new blood vessels in the retina. Cigarette smoke also contains dioxins which promote VEGF, vascular endothelial growth factor, another vasculogenic chemical. Smoking causes increased free radicals and oxidative damage, as well as drusen formation. Oxidative damage and cell death in macula causes central vision loss. High level of carboxyhemoglobin in smokers hampers the oxygen delivery to the macula. This causes lack of oxygen to the macula, resulting in macular degeneration and central vision loss. 5. Dry eye syndrome. Dry eye syndrome is a multifactorial disease affecting the production or normal functioning of tears. Smoke from the cigarette causes burning and eye discomfort. This occurs in primary smokers and passive smokers alike. Noxious particles found in smoke reduce tear stability and corneal and conjunctival sensitivity, which cause evaporative dry eye. 6. Uveitis. Uveitis refers to ocular inflammation or swelling inside the eye. It typically impacts the uvea, middle layer of the eye, but it can also affect other crucial eye structures which could result in permanent vision loss. Smoking cigarettes causes the release of chemicals that cause blood vessel inflammation, which can affect the immune system and cause uveitis. 7. Thyroid eye disease. The general population and patients with Graves' disease should be informed about the dangers of smoking and thyroid eye disease. Numerous hypotheses have been put forth on how smoking can lead to the onset of thyroid eye disease. The hypoxia caused by smoking may affect the release and activity of inflammatory mediators, which is thought to play a significant role in the pathogenesis of thyroid eye disease. Smoking can alter TSH, thyroid-stimulating hormone. Smoking also affects the immunological reactions involved in the pathogenesis of eye disease. 8. Optic nerve. Heavy smokers are believed to experience vision impairment due to nicotine interfering with the transmission of these visual signals. A study of patients recovering from optic neuritis found a significant red-green colored defect in the affected eye of heavy smokers as compared to non-smokers. The effects of smoking extend not only to our own health but also to the health of those around us. A healthy lifestyle begins with reducing smoking and eventually quitting for good.